Hello class, this week we're going to talk about anti-anginal drugs. Atherosclerotic disease of the coronary artery, also known as coronary artery disease or ischemic heart disease, is the most common cause of mortality around the world. Patients commonly die either from pump failure due to myocardial infarction, tissue necrosis, or fatal arrhythmia. Coronary artery disease may present in different forms such as angina pectoris, acute coronary syndrome, arrhythmia, shortness of breath, and others. Angina pectoris is a characteristic sudden severe pressing chest pain radiating to the neck, jaw, back, and arms. It is caused by coronary blood flow that is insufficient to meet the oxygen demand of the myocardium, leading to ischemia. The imbalance between oxygen delivery and utilization may result during exertion, from a spasm of the vascular smooth muscle, or from obstruction blood vessel caused by atherosclerotic lesions. These transient episodes, 15 seconds to 15 minutes, of myocardial ischemia do not cause cellular death such as occur in myocardial infarction. Chronic ischemia may lead to deterioration of cardiac function, leading in turn to heart failure, arrhythmia, and sudden death. Angina pectoris has three overlapping patterns: effort-induced or classical angina, unstable angina, and Prinzmetal or rest angina. They are caused by varying combination of increased myocardial demand and decreased myocardial perfusion. Classic angina is the most common form of angina and therefore is called typical angina pectoris. It is characterized by a short, lasting burning, heavy or squeezing feeling in the chest. Typical angina is primarily relieved by rest or nitroglycerin, which decreases myocardial oxygen demand. Unstable angina is classified between stable angina and myocardial infarction. In unstable angina, chest pain occurs with increased frequency, duration, and intensity, and are precipitated by progressively less effort. The symptoms are not relieved by rest or nitroglycerin. Unstable angina requires hospital admission and more aggressive therapy to prevent death and progression to myocardial infarction. Three classes of drugs used either alone or in combination are commonly used in treating patients with stable angina: organic nitrate, beta blockers, calcium channel blockers. These agents lower the oxygen demand of the heart by affecting blood pressure, venous return, heart rate, and contractility. Lifestyle and risk factor modification, especially cessation of smoking, are also important in the treatment of angina. Organic nitrates and nitrites used in the treatment of angina pectoris are simple nitric and nitrous acid ester of glycerol. They differ in their volatility. For example, isosorbide nitrate and isosorbide mononitrate are solids at room temperature. Nitroglycerin is only moderately volatile, and amyl nitrite is extremely volatile. This compound causes a rapid reduction in myocardial oxygen demand followed by a rapid relief of the symptoms. They are effective in stable and unstable angina as well as in variant angina pectoris. Organic nitrates such as nitroglycerin, which is also known as glyceryl trinitrate, are thought to relax vascular smooth muscle by their intracellular conversion to nitrite ions and then to nitric oxide, which in turn activates guanylate cyclase and increases the cell cyclic GMP. Elevated cyclic GMP ultimately lead to dephosphorylation of the myosin light chain, resulting in vascular smooth muscle relaxation. Sublingual or spray form nitroglycerin is the drug of choice. At therapeutic doses, nitroglycerin had two major effects. First, it causes dilation of the large vein, resulting in pooling of blood in the vein. This diminishes preload and reduces the work of the heart. Second, nitroglycerin dilates the coronary vasculature, providing an increased blood supply to the heart muscle. Nitroglycerin decreases myocardial oxygen consumption because of decreased cardiac work. The most common effect of nitroglycerin as well as of other nitrates is headache. From 30 to 60% of patients receiving intermittent nitrate therapy with long-acting agent develop headaches. High doses of organic nitrates can also cause postural hypotension, facial flushing, and tachycardia. Phosphodiesterase 5 inhibitors such as sildenafil, tadalafil, and vardenafil potentiate the action of nitrate to preclude the dangerous hypotension that may occur. This combination is contraindicated. The beta blockers decrease oxygen demand of the myocardium by lowering both the rate and the force of contraction of the heart. They suppress the activation of the heart by blocking beta-1 receptor, and they reduce the work of the heart by decreasing heart rate, contractility, cardiac output, and blood pressure. Propranolol is the prototype for this class of compound, but it is not cardioselective. Thus, other beta blockers such as metoprolol and atenolol are preferred. The calcium channel blocker protects the tissue by inhibiting the entrance of calcium into the cardiac and smooth muscle of the coronary and systemic arterial beds. All calcium channel blockers are therefore arterial vasodilator that cause a decrease in smooth muscle tone and vascular resistance. At clinical doses, this agent affects primarily the resistance of peripheral and coronary arterial smooth muscle. Its use in the treatment of effort-induced angina rely on the reduction in myocardial oxygen consumption resulting from decreased afterload. As with all calcium channel blocker, constipation is a problem. Here, the drug commonly used in treating angina with concomitant disease. The figure on the left illustrates various forms of angina. The figure on the right shows clinical management guidelines. That's it. Thank you for your attention.